Ladies and gentlemen, I'm happy to speak to you today about pulmonary tuberculosis and Holy Ramadan. Pulmonary tuberculosis, it means that a disease which causes tubercles in the parenchyma of the lung. These tubercles may coalesce together to form areas of granulomas, and these areas of granulomas may cavitate and breakdown occurs inside it and causing cavities. These cavities may involve a blood vessel or a lymph vessels, and this causes complications which we are afraid from it. So pulmonary tuberculosis is considered a dangerous disease, but if we diagnose early and taking a promote treatment for it, it is considered a very easy disease because it is curable 99% of cases. Pulmonary tuberculosis is an infectious disease caused by a bacteria called Mycobacterium bacteria. Also, this disease is related to the socio-economic state of the individuals, so it increases with the low or decrease standards of socio-economic states, where we find very bad housing condition, also bad nutrition, also addiction, smoking, and this is present especially in the slums. Also in the developed countries nowadays, it returns back and caused a problem nowadays, where in the past it's only a problem in the developing countries, but nowadays it becomes a problem in the well-developed countries. Tuberculosis is infectious, as I said. It is transmitted by droplet infection through sneezing or coughing, especially when be close to the patient, especially in the narrow areas and closed areas also. Tuberculosis in brief, we will speak and will be transmitted to the symptomatology of it: cough, expectoration, and hemoptysis ranging from blood tinged to severe or frank hemoptysis. Also chest pain if the pleura is involved, and there are general symptoms as loss of weight, anorexia, weakness, lassitude, lack of concentration. These are, in brief, the symptomatology of pulmonary tuberculosis. So any case of fever prolongs more than 2 weeks must be x-rayed and investigated by the chest physician to exclude pulmonary tuberculosis, especially in the predisposed areas, as I said before. Complication of pulmonary tuberculosis, transmission of the disease from the parenchyma of the lung to the pleura, and also causing dry pleurisy or pleural effusion, or rupture of the cavity, as I said before, from the parenchyma into the pleural cavity, causing pneumothorax. Also, from the most important complications of pulmonary tuberculosis, hematogenous spread of the tubercle bacilli through the lymph vessels or through the blood vessels to the other vital organs, which is considered as a very dangerous complication, as meningitis of the brain, causing tuberculous meningitis, or the kidney, or the liver, or any other vital organs, as suprarenal glands, as genital glands. These all vital organs may be involved from the spread of the tubercle bacilli by the hematogenous pathway. Also, there may be a lymphatic spread through the lymph vessels, and will causing involving of the all the lymphatic system and or parts of the lymphatic system by the tuberculosis. These are dangerous complications of pulmonary tuberculosis, but we are happy nowadays because we don't see these complications due to the high educational, health educational programs to the societies by TV and radio and all media, and also the new era of new housing, sanitary housing conditions in new cities as 6 October and 10 من رمضان and 15 مايو. All these new cities also considered a preventive measurement against tuberculosis by avoiding the housing condition in the slums. Also, proper nourishment is considered a very important item in preventing and control of tuberculosis. Also, proper sanitary behavior, personal behavior is very important, as preventing smoking in closed areas. Very important item nowadays to avoid the smoking in the closed areas. This is considered a very easy method of infection, easy method and the predisposing factor for gaining tuberculosis. So these measurements improve, very important to avoid and to prevent pulmonary tuberculosis. Management or treatment of pulmonary tuberculosis includes early diagnosis of the disease, also early and to promote treatment of the disease, and the drugs of tuberculosis may exceed 2 drugs and may exceed 6 months according to the regimen used for the management and the treatment of pulmonary tuberculosis. But the very important item also bed rest, especially in the active state and the active stage of pulmonary tuberculosis. And also the isolation of the patient is a very important item in the management and the control of pulmonary tuberculosis. When we are speaking about the nutrition in pulmonary tuberculosis, because we need a very strong immune system to defend our bodies against these virulent organisms, so we advise all tuberculosis patients, especially in the active and the early stages of treatment, we advise them not to fast in Holy Ramadan, because we need more nutrition, proper nutrition, because I need a strong immune system, and also I will shorten the course of treatment and facilitate the action of drugs to overcome these virulent organisms.